The following portion of the Arizona Daily Mix is sponsored by Arizona Reproductive Medicine Specialists.
National Infertility Awareness Week is coming up in April, and Dr. Drew Moffitt is here to talk a little bit about destigmatizing the issue and how they can help. Welcome, doctor. Thank you for being here.
Nice to be here.
Okay, so this is a super sensitive topic for a lot of people, and I personally have several friends who have walked through it, so I've walked through this journey with them, and it can be really, really difficult. Can you tell us a little bit about what people experience when they're facing this infertility journey?
Sure. Well, first of all, it's really common, but everybody thinks that they're the only one going through it. But about 1 in 6 people will experience it in their lifetime. So probably you know somebody or you're somebody who's experienced it. That's number one. And it affects both sexes equally. So male and female have the same issues. And then the big issue is there's a lot of grief that goes with it. So the studies have shown that a woman that is trying to get pregnant in a given month and doesn't get pregnant that month, experiences the same amount of grief as if they lost a brother or a sister. So, you know, most of us are going to lose somebody close to us once in our life, but not every single month, month after month for years. So there's a lot of emotional support they need, and hence National Infertility Awareness Week.
Yeah, I love that we have a week dedicated specifically to this because it is something that is so difficult to walk through. You do feel alone, and like I said, I know a lot of people who have walked through this. What are some things that we can do to kind of destigmatize that, to get this out there? I mean, other than this awareness week that's coming up, what would you suggest that we can all do to kind of like help this not be so scary?
Well, I think get it out in the open. No, it's not a secret. So that one of the things that we do during this week is we have Wear Orange Week. I don't know why they picked orange, but orange is the color. So Wednesday, the 24th, is the day to wear orange, and maybe post something on social media just giving your support.
That's great. And yeah, I think, you really hit the nail on the head here when you said this is not just a women's issue. I think a lot of people attribute it to women, but this can be medically a male issue, but also if you are a spouse of a man or a woman coming in and you want to start your family, this is equally as important to everyone in that family, both sides of the coin.
Yeah, and the thing is coming in, you know, one of the big problems, they say that less than half of people who have this problem will actually seek help. Even if their OBGYN refers them, less than half of them actually end up in our office, or they put it off until it's too late. They're coming in age 40, you know, and things are a lot more difficult at that age. So I think the message is seek help early.
And you know, we talked about this a little bit beforehand, and I said there's that ticking clock, and I hate that we call it that, but it's so true, right? There is not an unlimited amount of time. So getting to this early, even though it might feel scary, getting to this earlier is going to have a better outcome for you.
Yeah, and it can be reassuring. There are tests that we can do where we can say, you know, your egg supply is great. You know, don't worry about it for a little while.
There you go. See, there can be really positive things that come out of just going to check it out. And I know that you guys do things like freezing eggs, and you have all these amazing treatments available. Tell us about some of that.
Yeah, so it's a common thing now in people who are wanting to kind of build their career and then have a family. To freeze your eggs is sort of an insurance policy, and we're particularly good at that. So that's a good thing to do if you're really concerned.
And you know, if you have gotten to the point that maybe it is a little bit later on, maybe you are facing some of those challenges, do you guys offer other things like IUIs, IVF? What all can you do for people?
Well, we have lots of things, but it comes down to doing something simple like inseminations or in vitro fertilization, where we can make embryos, store them for the future. They are frozen forever, and there's no expiration date. So there's a lot of things we can do to help you build your family. I like to call this week family planning week. So plan for a family and just figure out when you're going to do it so you're not caught too late.
And that's such a great thing that we have this week coming up here in April. Now is the time to talk about it, to help people feel like you're not the only one. 1 in 6, that's so common. You're not the only one experiencing this. So wear your orange on the 24th, get the message out there, and just help people feel maybe a little bit less alone in this somewhat difficult journey.
Exactly.
That's really cool. Well, doctor, thank you so much for being here. And the information was on the screen if people want and need to come in and work with you. So
great.
Thank you so much.
Nice to be here. Thank you.
Yes, absolutely. All right, guys, stick around because we have more of the mix coming up after this. Yeah, I know.
The preceding portion of the Arizona Daily Mix was sponsored by Arizona Reproductive Medicine Specialists.